Although radical life extension is an intriguing idea, so far nobody has figured out the secret to keeping humans alive and thriving for 120 years or more. What medicine does know how to do, actually really well, is to prevent tens of thousands of premature deaths every single day around the world. If only we had the will to do it. From KERA in Dallas, this is Think. I'm Krys Boyd. Dr. Tom Frieden directed the Centers for Disease Control and Prevention under President Obama, and today he is CEO of the organization Resolve to Save Lives. In those jobs and in his earlier work as health commissioner of New York City, his focus has been on turning knowledge about what affects health into action, with a particular focus on how we can prevent disease from taking hold in the first place. His new book is The Formula for Better Health: How to Save Millions of Lives, including your own. Dr. Frieden, welcome to Think. Before we get into the formula that this book offers, I would like to talk to you about this open letter published in the New York Times this month, signed by you and 8 other former CDC directors. The headline was, "We ran the CDC. Kennedy is endangering every American's health." By Kennedy, of course, you mean Health and Human Services Secretary Robert F. Kennedy Jr. Can you talk about some of the concerns you and your colleagues articulated in that op-ed?
This was a group of former CDC directors that go back more than 30 years, Democratic and Republican administrations. And what we're seeing is really unprecedented. This really isn't about Democratic or Republican. It's about fact versus fiction, and really dangerous fictions. What we've seen from Secretary Kennedy is a pattern: deny, distract, destroy. Deny basic facts, distract from the real damage he's doing, really pulling apart our health protections, and destroy a lot of our infrastructure for keeping Americans safe and healthy.
What could the motivation be for that, if it is, as you say, deliberate?
Well, I don't know what his motivation is. What I can say is that many of the things that he's doing will serve the interests of people who want to file lawsuits against the vaccine manufacturers based on unfounded claims. For example, the disproven claim that vaccines cause autism. That claim, if felt to be true by some courts, could result in very large settlements for trial lawyers. And that's frankly the work that Secretary Kennedy did before becoming secretary.
I'm actually curious about how the writing of that op-ed worked. Did you and your colleagues sit down and have like a Zoom meeting where all the signers talked about what would be included?
We all contributed. We all had certain perspectives and points, and we wanted to make sure that it was a common denominator, that it was something that we believe, that it was something that all of us were comfortable with, and that we were sticking with the facts. And the facts are very straightforward, that we are not seeing the kind of fact-based decisions being made that are traditional. And this is an assault on public health, and an assault that will have really serious consequences for Americans. Already, what we've seen is that if you're a healthy young adult, or if you want your kid, or if you're pregnant, and you want to get a vaccine to protect yourself against COVID, it will be much harder. It'll be harder for many pharmacists to stock it. It'll be harder for doctors to give it. It'll be harder for insurers to cover it. This isn't about mandates. This is about people's freedom to get the kind of health care that they choose to get. And public health really shouldn't be partisan. I think Americans agree on the basics. They want government to protect our health and security, and 93% of American parents get their kids completely vaccinated.
When you held the post as CDC director, did it feel like a partisan job, given that you were serving under a Democratic president?
Absolutely not. I had really good relationships with both Democrats and Republicans in both the House and the Senate. In fact, some of the programs that we developed together were developed primarily with the Republican side on things like health security. So I don't think that public health necessarily should be or has to be partisan, but it does have to be on the side of the facts and on the side of keeping people safe and healthy.
Has the mission of the CDC changed a lot since its establishment in 1946?
It's a really interesting question, because there's a narrative that I think is incorrect, which is that CDC has gotten away from its basic mission, which is protecting Americans against infectious diseases, and is now doing all sorts of other things in these areas that aren't so core. That's, I think, really mistaken. CDC has one core mission, which is to protect Americans from threats. And CDC works 24/7 for that mission. And whether that means threats that are infectious or otherwise, threats that are natural or man-made, threats that come from this country or anywhere in the world. Let me give you an example. When I was CDC director, we had the outbreak of Zika in Brazil, and then in Puerto Rico and Miami. And in that outbreak, we saw horrible birth defects in children born to women who were infected with this mosquito-borne virus, the Zika virus. This was unprecedented. It had never happened before with this virus. There hadn't been a viral cause of serious birth defects identified in half a century since rubella. And yet at CDC, we were able to bring together not just the infectious disease group, but the birth defects group, the reproductive health group to support women who are pregnant, the vector control group to do mosquito control activities, the laboratory testing group, because it was really quite challenging to do that laboratory testing, some of the advanced laboratory work where we were able to actually see what this terrible virus was doing to the brains of infants. And with that, we were able to support parents, support families, and actually stop the outbreak in Miami. So that couldn't have been done if CDC hadn't had multiple different agencies or different entities working as part of it. When an outbreak first occurs, we may not know if it's infectious, like Legionnaire's disease, which CDC found, or environmental, like toxins that were in some vaping products that made some people very sick, or some combination like the toxic shock syndrome, which was a toxin related to menstrual products. That all three of those CDC identified because it had the ability to protect Americans from threats. And if you tie one hand behind CDC's back, it's not going to be able to protect America as effectively.
That's a laudable history that you've just laid out for us. Secretary Kennedy now says Americans have lost trust in what the CDC has to say. Have you seen evidence that that's true, that Americans have lost trust?
I think if you look at the polling data, it's not just CDC, it's science, it's government, it's doctors, and it does break down largely on partisan lines. You don't see that decrease among Democrats. You do see it among Republicans. And I think that's a problem because CDC has to serve all Americans. And I'm critical of the way both the Trump and Biden administrations handled the COVID pandemic. I think both made mistakes. One of the mistakes that the Biden administration made was to insist that CDC talk from the White House. That's really unfortunate because that means that people who didn't vote for President Biden weren't likely to take that seriously.
What have you learned over time about choosing the right messenger for any particular public health message?
It's really important. Sometimes we think of communication as kind of about a program. Communication is the program in really many important ways. And what's key is to identify what's the right message, who is the right messenger, and what's the right time and place to give that message. And one of the things that's so important is communication isn't about telling people, talking. Communication is about listening, hearing other people's perspectives, understanding them, addressing people's valid concerns. At the height of the COVID pandemic, there was a focus group with people who were very reluctant to get vaccinated, and we spent 2 or 3 hours together. And what really struck me about that group is these are folks who had legitimate questions, and they felt not only were their questions not being answered, but that they were being vilified for even asking those questions. And that's not right. It's really important to listen to what people have to say, to address their concerns. Maybe you agree, maybe you don't, but at least we should be having one conversation, not two.
The state of Florida is currently moving toward eliminating vaccine mandates for children attending public schools. If that goes forward, What might happen to vaccination rates among kids without these mandates?
Well, I'm going to go with an answer here that may not be so popular for some. I've looked deeply into the data on vaccine mandates for schools. They definitely help. They increase the vaccination coverage rate, but they help if people agree with them. Uh, and if people don't agree with them, they are problematic. And so I think it's a mistake for Florida. It will cost money because there will be preventable outbreaks in Florida schools. But ultimately, all decisions on things like mandates need to be made with the community as part of that decision.
Lots of people who have concerns about vaccines argue medical science today has better treatments to address serious illness in people who are infected with vaccine preventable diseases. I'm curious about your response to that.
Well, it's really clear. Vaccines are one of the greatest accomplishments of mankind, and they are in part a victim of their own success, their own progress. We don't see polio around. We don't see what was before the vaccine era, millions of children infected with measles, thousands becoming permanently disabled from measles when we had big outbreaks, and hundreds dying from measles in the US. Globally, it's very different. Globally, there are still about 100,000 deaths from measles each year. It is one of the leading killers. And vaccines are safe, they're effective, and there is no better protection against COVID or the flu than vaccination.
I want to broaden our focus to the subject of this book, which covers preventable deaths from all kinds of diseases, infectious and also lifestyle related. Your formula is made up of three elements: see, believe, and create. What does the see part cover?
Public health has a superpower. Public health can see the invisible, and that includes trends that are deadly. That includes microbes and toxins. That includes the reasons why we ignore some of the risks that might kill us. That includes whether programs are succeeding or failing, and being brutally honest with ourselves about that and fixing those that aren't doing as well as they should be, and also seeing the pathway to progress. And with that ability to see the invisible, we can take the first step in our own lives and in our communities for being healthier.
When you say that we over medicate conditions that cause symptoms and under medicate conditions that don't, what does that mean? Why does this happen?
It's a great question. And it's one of the examples of seeing the invisible. One thing that's invisible, in fact, it's called the silent killer, is high blood pressure. High blood pressure kills more people than any other cause. And if we look at our healthcare system, the single most effective thing we could do to help people live longer, healthier lives is to better control blood pressure. And yet, we only get that right less than half the time in the US. We spend $4 trillion of our economy on healthcare, and we can't get the most important question right even half the time because high blood pressure and the failure of our treatment programs are largely invisible. In contrast, if we have pain, it's really important that we address the causes of the pain and we provide the best treatment. It might be physical therapy, it might be some medications, it might be a variety of changes to how people move or work or what the source of the pain is. But we tend to over medicate that. And that's one of the drivers of the opiate epidemic. Similarly, and this is one area where I actually agree with Secretary Kennedy. I think we over medicate attention deficit disorder and we over medicate insomnia. A lot of people are on medications that probably don't help them much and do have negative consequences. So I think we do, as you say, we under medicate those things that are invisible. It might be hepatitis C infection or high cholesterol levels or hypertension. And we over medicate things like hyperactivity and pain that need to be managed more comprehensively.
Why do we miss the symptoms of something like hypertension or high blood pressure?
It's completely silent. The first symptom most people have of high blood pressure might be a heart attack or a stroke. In fact, I learned this in doing research for the book. There was an Italian physician, Scipione Rivarocci, who in 1896 invented the blood pressure monitor, what's called a sphygmomanometer. He used a bicycle inner tube and a mercury gauge, and until that moment, no one in all of human history had actually measured blood pressure. He measured it, and over the following 130 years, we have shown that the higher the blood pressure, the higher your risk of a heart attack, stroke, dementia, kidney failure, or death from any one of those causes. And that the better we treat it, bringing it back down to ideally below 120, that first number, over 80, the less likely we are to have a heart attack, stroke, dementia, kidney failure, or early death.
I don't want to get too hung up on this question of hypertension, high blood pressure, but this is a really simple question for you and maybe not for all of us listening. Can you explain why hypertension causes damage in the body? What happens to the vascular system if we go around for years without realizing we have this or without seeking treatment?
It is called the silent killer because if you have high blood pressure, with every single beat of your heart, every second of every day, your blood is pounding like a battering ram on the arteries of your brain, of your heart, of your kidneys, and damaging them in such a way that predisposes you to an early and unpleasant death.
If we know we have it, how simple is it to treat and keep under control?
It's really simple. The medicines are all generic. They're all safe. They're all effective. And I want to say here at the outset, I've never taken any money from the pharmaceutical industry, nor has my organization, and we never will, nor will I. But these are great medicines. Franklin Delano Roosevelt, FDR, died from malignant hypertension. He had a blood pressure of over 260, over 160. And he died in his early 60s. He could have lived another 20 years if we had had the medicines then that we have now. There's also something you can do to prevent high blood pressure, but that's a lot harder. Most people, even if we do everything right, myself included, I have to take medicines to keep my blood pressure within a healthy range. But one thing you can do is switch the kind of salt you use from regular salt to low sodium salt that's enriched with potassium. We basically have a potassium deficiency. We consume way too little potassium and way too much sodium. Now, if you have kidney disease, you have to be careful because you can get too much potassium. But for everyone else, we're consuming way too little, and there's a lot we can do to be healthier. There are other things we can do, like be physically active, but most people with high blood pressure will need to be on medicines every day for the rest of their life.
Almost 9 in 10 folks over the age of 65, maybe you're there or skating close to it, have hypertension. It's so common that you think a lot of doctors assume it is normal for that age group.
That's exactly right. And that's one of the problems. There are fascinating studies that were done decades ago that compared more than 30 communities in 28 countries. And they found 4 where people had no high blood pressure. Their blood pressure was 90 over 60 when they were 16 years old and 90 over 60 when they were 60 years old. And the common feature of those 4 societies is they consumed very, very little sodium, about a fifth or less, or a third or less, what we consume today. And as those societies industrialized, high blood pressure came in. So high blood pressure isn't a normal part of the aging process. And part of this first component of the formula, to see the invisible, is to see things that may be not causing symptoms. They may not even be in the abnormal range, but they may be heading toward the abnormal range. And if we take adjustments now, we can live longer and healthier.
Cutting back on salt in our food is a good idea. You also mentioned in the book this test that can look at the ratio of these 2 things you've mentioned, potassium and sodium. What should we ask for this test? Will we automatically get it when we go to the doctor?
It's actually very hard to measure. And so the better thing to do, first off, you don't have to do anything with this, but people like to count things, like count calories. What you could do for a day is just look at all the labels and look up the food that you're eating from the supermarket and see how much sodium is in it and how much potassium is in it. And ideally, you would be consuming more potassium than sodium. To do that, you're going to have to both reduce the amount of sodium you consume, and some of the foods, particularly in restaurants and packaged foods, are just astonishing in how much sodium they have. And it's not the kind of thing that you would do. You wouldn't add a few shakes of salt to your breakfast cereal, but you don't have to, because most of the breakfast cereal companies already did that. And there's salt there. Salt is heavy. It draws in water. It's palatable, and it's cheap. So it's all over our food supply. So if you just measure by tracking, if you want to, how much sodium you consume and look up how much potassium you consume, then figure out what it would take to flip that ratio. So you're consuming at least as much potassium as sodium. That's actually the strongest dietary predictor of heart health.
Even in this era of misinformation and disinformation, there is no shortage of good advice available to everyone about the importance of regular exercise. What accounts for the CDC's own statistic that less than a quarter of U.S. adults get the recommended amounts of both cardiovascular and strength exercise every week? Is there something wrong with the guidelines or the messaging or with us?
Well, it's hard. This is one of the things I talk about. Public health has had what is sometimes called the Cassandra curse. Cassandra was a priestess in Greek mythology who had the gift of foreknowledge. She could see the future, but she was cursed. No one would believe her predictions, and therefore the tragedies that she could have avoided didn't get avoided. I think in many ways, public health has been like Cassandra. We can predict the deaths that are going to happen, but we haven't until recently been able to prevent them. And all of us are like that in our own lives as well. I think we know that if we get less physical activity, we're more likely to have arthritis, depression, insomnia, diabetes, hypertension, cancer, all of those things. Physical activity is the closest thing there is to a wonder drug. There are some things that we as a society can do to make it easier for people to get regular physical activity. For example, have more biking paths and walking paths and encourage people to use stairs in buildings by making them pleasant. But ultimately, it's up to you. This one's on each of us to figure out ways to be physically active that we're going to stick with. Now, the most accessible is probably walking. A brisk 30-minute walk 4 days a week can do wonders. And there's some evidence that doing that out of doors has even more health benefits than doing it indoors or on a treadmill. But any way you can get physical activity is really important.
This takes us to the believe portion of this book. Is there something about just average humans that we don't want to believe, things that are challenging to do that might actually be good for us?
You know, it's really important because we tend to believe that the world is the way it is and it will always be that way and it always has been that way. But actually, things have changed a lot, and that can tell us that things can change a lot again. There can be a lot more progress than there has been so far. Look, we have way too much heart disease in this country, but still in the 50 years between 1960 and 2010, there was a 2/3 drop in heart disease in the U.S. So there's been huge progress, and we're not done. We can make huge progress more. There are great new medicines. There are great new knowledge. So we can see that past progress. We can also make kind of phased progress to figure out one step at a time. How can we make more progress to build optimism? Because ultimately, optimists live longer, and it's that kind of spark that takes us from seeing the things that might kill us to actually creating a healthier future. We have to believe that we can change them. We have to shatter what's an illusion of inevitability.
Dr. Frieden, we live in an age of hyperbole, certainly in political discourse, but really in all discourse. Is it ever tempting for public health professionals to overstate hazards in order to get people to sit up and pay attention?
I think that is an issue. I think we really have to be clear. Study after study have shown that people aren't very good at judging risk. we tend to overestimate the risk of things that we can't control and that are in our immediate future. And we tend to underestimate the risk of things that we can control and are in the distant future. So we might be very fearful of our children being kidnapped, which is a terrible thing. But the odds of that happening are much lower than a lot of other bad things happening to them or to us that we have a lot more control over. So believing that we can make a difference is really important to taking that critical third step and creating a healthier future.
So, how do you create messaging that effectively communicates both the gravity of certain habits that are really common that we may have without making the solutions seem insurmountable, seem too hard, enough to make us give up the effort?
Absolutely. Well, let's take an example of tobacco use. Most Americans who have ever smoked have already quit, but still, tobacco kills almost 500,000 Americans every year. It's our leading preventable cause of death. And if you look at tobacco use, think about, we talked about the Cassandra curse and not seeing distant things. If a third to a half of people who smoked were going to drop dead after their next cigarette, nearly everyone would quit, excuse me. But actually a third to a half of today's smokers are going to get killed by tobacco. It's just going to be years in the future. As a doctor, as a physician, I've taken care of those people. I've seen them saying, oh, I wish I had quit 20 years ago, 30 years ago. So part of motivating ourselves is to imagine the distant future as if it were tomorrow and then use that to motivate ourselves. The other part that's really important is to find things you like doing. You're going to be way more likely to stick with something you enjoy than to stick with something that's denying yourself a pleasure. So finding food you enjoy, finding physical activity you enjoy, these are the ways to stick with the program. Finding a doctor or other clinician who can be your primary care doctor who you enjoy and feel respected and listened to. Take the example of food, right? We all like sweet, salty, fatty food. That's kind of hardwired. But there's a lot of healthy foods that are quite delicious. That might be unsalted or lightly salted nuts, vegetables you enjoy, fruits, fish, and really all of those within reason, the more the better. Same is true for foods that are high in potassium, sweet potatoes, salmon, spinach, avocados, bananas, yogurt, pistachios, tomatoes, mushrooms. These are all potentially quite delicious foods. So you're more likely to stick with something if it's easier for you and you enjoy it more. And that's really one of the essences of public health. People sometimes think of public health as that annoying nag telling you not to do the things that you want to do. But actually, if you have to tell people that, it's a symptom of the failure of public health. Because if public health succeeds, if we just go about our lives, don't give it a second thought, go with the flow, we're going to be healthy and not have unpleasant, uncomfortable, disabling conditions.
It's only been not quite 6 years, but it's almost hard to get ourselves back to the early days of the pandemic and remember all that we didn't know at the very start of realizing this infection was a thing. Um, how did public health messaging in the earliest days set up conditions that contributed to people distrusting or denying or pushing back on that messaging?
Well, first, I have to say, if you go back even today and you look at what Dr. Nancy Messonnier of the CDC said, it would be really hard to get even a word better. She was right on target. She was clear that we have to be humble. We don't know if it'll be bad, but it might be. And we'll be learning more and we'll share more with you as we learn more. That message was off message with the first Trump administration, and she and the CDC were silenced for essentially the remainder of 2020. What you saw often in messaging after she was silenced was the failure to explain very clearly, this is what we know now, this is how we know it, this is what we don't know, this is what we're doing to try to find it out. Based on what we know now, here's what we're recommending. So I do think the idea of being too definitive, too certain was a big problem with public health communication.
We just saw the most recent CDC director fired, accompanied by a number of high-profile departures. Where do you stand on this? The people who are staying within the organization and trying to fight the good fight, and the people who say, I simply cannot work under these conditions. What
Well,
choice would you have made?
I'm not there now, so I wouldn't want to second guess anyone. I, I do think these are unprecedented times. Frankly, there are always some frictions between HHS and CDC, but this is different. There has never been a CDC director fired before. The decision announced on social media that young people couldn't get a COVID vaccine anymore was taken without knowledge or any input from the CDC scientists who have spent their lives studying this. These are not folks who have an interest in vaccines. These are folks who have an interest in keeping Americans safe and healthy. For the people who are still working at CDC, I think we owe them thanks. I spent more than 20 years at CDC, so I'm not unbiased. I think it's a wonderful organization. Sure, it has problems. It needs to be more practical. It needs to be faster. It needs to be better connected with state and local governments so that we're working together to protect people. But the folks who work there are so dedicated. They really devote their lives to working in very specific areas to identify the threats and protect Americans from those threats. And I just hope they'll be able to continue to do that life-saving work.
I want to talk about an infectious disease that no one says is just like a bad case of the flu. Everybody recognizes is dangerous and you don't want to get, and that is tuberculosis. What was this question that Dr. Carol Stivo asked you in, I think it was 1993, that shaped how you have approached your public health career ever since?
Thank you. So Carol Stivo had survived concentration camps in World War II. He had spent more than 20 years studying tuberculosis in Europe. He had a very deep understanding of it. He then spent a decade in Tanzania figuring out how to treat tuberculosis there. And I was made head of the New York City Tuberculosis Control Program when we had a very large outbreak of multi-drug resistant tuberculosis, which as an epidemic intelligence service officer, I had documented and was working to stop. And Stieblo came to the city health department and he said, well, New York City diagnosed 3,811 patients last year. And this booklet that you wrote, Dr. Frieden, tells me all about them, but it doesn't tell me the most important thing. I was pretty offended. I said, what's that? He said, it doesn't tell me how many of them you cured. And I was so ashamed because it was obviously the most important question. And in all of the details, we had lost that simple question. And that fundamental question is absent from much of our healthcare system as well. We talked about high blood pressure earlier. Less than half of Americans who have their blood pressure adequately controlled. And 90% of those who don't have their blood pressure controlled have seen a doctor in the past year. So our system is failing. And what the Stieblo question forced me to do was to be rigorous about what's really happening. What are the real outcomes? You may think your program is succeeding, but unless you're brutally honest, you can't see the real impact of your work.
He also pushed you to think about the proportion of patients cured, the ratio of patients cured to patients treated. Why would the proportion matter even more than the number?
Ultimately, it's about the denominator. It's about every person who needs treatment, not the ones who happen to walk into your health center. And that's true for high blood pressure also. We see doctors all the time who say, oh, all of my patients have their blood pressures controlled because the ones who come back have their blood pressures controlled. But the ones who didn't come back, those are the people having a stroke or a heart attack tomorrow. So it means taking responsibility for the entire population that is assigned to you. If you're a health department, that's everyone in a community. If you're a health plan, that's all of your beneficiaries. And for each individual, it's thinking about your outcomes. Is your blood pressure controlled? Are your lipids at a healthy level? Are you getting enough sleep? Are you getting enough physical activity?
This is where the create portion of this book comes into play. Tell us about what creative public health work looks like.
First, you have to get organized. What we find often is that programs fail because they're not well organized. In an emergency, we use something called incident management, something that comes actually from firefighting, but it's very effective as a way of managing in emergencies. But organizations need to be rigorous, need to be effective. Once you're well organized, you need to keep things simple, because only with simplicity can you scale stuff up to reach everyone who's needed. And you have to communicate well, because you have to listen to what people are saying. You have to be able to convey your programs. And ultimately, you also have to overcome barriers, because the fact is that although public health is really good for the public, it's bad for certain groups like the tobacco industry. And you have to be able to overcome those barriers to protect people from the cancers and the heart attacks that can be prevented.
So many public health successes, including presumably the long success of widespread vaccination programs, those are invisible, right? Because by nature, they worked, so we don't hear about them. We don't see a ton of cases of polio or whooping cough, or until recently, measles, because vaccines did the job. Why is it important that we keep talking about those quiet victories if they are decades in the past?
Two reasons. First, if we don't recognize the past progress, it may come back to haunt us. We could have really large measles outbreaks in the US in the next 5 or 10 years if our vaccination rates continue to go down. Second, it can give us confidence. Hey, we controlled these things. I think we can control much more. Right now, we assume heart attacks and strokes are just a normal part of the aging process. I think we could make heart attacks and strokes under the age of 70 as rare as trachoma and typhoid fever are today, if we follow the formula, if we do what's proven to save lives, and we empower people with information, we empower people with easy steps to live a longer, healthier life.
You note in the book something that seems so outrageous to me that I had to go look it up elsewhere to make sure that the fact checkers hadn't missed this. The U.S. spends at least 300 times as much on military defense as health defense.
Absolutely. Isn't that amazing? There is no war in American history that has killed 1.5 million people, and that's what COVID killed. And yet, we spend so little on public health, and the money we spend has such a great payoff. The problem is we don't see that payoff. The current administration eliminated the CDC's tobacco control program. One of the many things that tobacco control program did was to run a national ad campaign that helped hundreds of thousands of smokers quit. By one estimate, it saved $8 billion a year in healthcare costs for a cost of less than 1/10 of that. And yet actually almost about 1/100th of that. So even when these programs save money, they don't save money for public health. They save money for society.
What about folks who say public health looks like something that's that's a nanny state? That's the government taking care of people when it's the job of individuals to take care of themselves, their families, their individual health.
I think we shouldn't let individuals off the hook. No one's going to put sunblock on you or force you to get exercise or encourage you to eat healthy. But we have to see the influences on our health. Our health doesn't happen in a vacuum. Whether people smoke, drink too much alcohol, use illicit drugs, get enough physical activity, these are largely determined by outside forces. That doesn't let you off the hook. But the fact that obesity rates have tripled isn't because our willpower is less. It's because our food environment has gotten so unhealthy. In the book, I go through some of the many ways the tobacco industry has made cigarettes more addictive. This makes it harder for people to quit. And this is an example of how when public health is at its best, you don't have to think about the healthy decision. You're not influenced by companies that are getting rich off of making you sick. And that right now is what's happening, whether it's tobacco or junk food or other products. Also, public health has a very important role in just providing information. So you decide what you want to do, and in protecting people from others. None of us want our kid to be killed by a drunk driver. And yet it's public health that supported the laws that make driving under the influence of alcohol less likely and have reduced the number of kids killed by a drunk driver. And there are also certain things that we can only do well together. Yeah, you can boil your water if you want, but isn't it easier if we all get together and have good, pristine water coming from the reservoir so we don't have to boil it at home?
Is there any reason that a focus on lifestyle-related public health interventions is incompatible with a robust program to create and encourage access to vaccinations against infectious disease?
We can walk and chew gum at the same time. I sometimes hear Secretary Kennedy saying it's a terrible problem that people are taking all these medicines. Well, I do think there's some medicines that are overprescribed and overused, but there are other medicines that are underprescribed and underused. And there's a little bit of a misconception that anything natural is good. The bubonic plague is natural. Some natural things are wonderful. Some are not wonderful. And given the reality of modern life, I mentioned the 4 communities that had no high blood pressure. Well, we're not likely to get down to a 10th or a 5th the amount of sodium we're consuming today to be that way. So even if we're wildly successful with reducing sodium, increasing potassium, getting more physical activity, there's still going to be tens of millions of people who need to take medication for high blood pressure. That's not a failure. That's just part of modern life. You wouldn't, I hope, want to say, if you've got a cancer that can be cured, why don't you try these other things that might work when we know that there is something that will work?
I know your time is limited, Dr. Frieden. I have just one final question. Will the CDC survive this period of upheaval in a form that is recognizable to the generations of people who have worked there in the past?
I don't have a crystal ball. I can't predict what the future will hold. I do know that facts are stubborn things. There will be another pandemic. It will hit our shores. Whether or not we are prepared will determine not only how many people survive, but how much damage there is to our economy. And it's not just about the next pandemic. There are lots of things killing people today that don't have to kill people. And we need the CDC to identify what those things are and then provide the information so that communities, states, other parts of the federal government can decide whether or not they want to take action. To give just one example, the so-called forever chemicals like PFAS or PFAS, that's in about half of Americans' water. The CDC is able to measure through its studies how much exposure there is and can track what the impact of that is on American health and American life. So I don't know whether CDC will go back to being as good as it was, better than it was. I know that right now it's been badly injured, and because of that, all of us are less safe.
Dr. Frieden, thanks so much for your time.
Thank you very much. I've enjoyed the conversation.
Think is distributed by PRX, the Public Radio Exchange. You can find us on Facebook, Instagram, anywhere you get podcasts, and at our website, think.kera.org. Again, I'm Krys Boyd. Thanks for listening. Have a great day.